Before the advent of modern medicine toward the end of the 19th century, the causes of mental illness were largely a mystery. Throughout Western civilization, people showing overt signs of severe mental illness were often considered possessed by demons and were primarily isolated from society in horrific living conditions. Large mental hospitals, such as the New Jersey State Lunatic Asylum, were constructed in the middle of the 19th century as a first step toward addressing the inhumane treatment of the mentally ill. As the causes for mental illness were still a mystery, this hospital was designed primarily as a quiet sanctuary with treatments limited to basic medical care and moral talk therapy. German psychiatrist Emil Kraepelin was the first to distinguish manic depressive psychosis, known today as bipolar disorder, and schizophrenia as separate conditions with unique symptoms. His work in classifying mental disorders was a fundamental step in understanding and treating people suffering from these illnesses, and is still recognized today. At the turn of the 20th century, the primary treatment for severe mental disorders was psychoanalytical therapies, also known as talking cures. These therapies were popularized by Sigmund Freud, among others, and while effective in treating symptoms of stress and tension related to many disorders, they did not address underlying physiological issues. In 1908, Clifford Beers published his autobiography, which detailed his own dehumanizing experience in a Connecticut mental institution, as well as his research of institutions with similar conditions around the country. He went on to found the National Committee for Mental Hygiene, which would develop into the largest mental health organization in the U.S., known today as Mental Health America. Mental Health America's symbol is this bell, which represents past triumphs over inhumane practices. Metal shackles, which were once used to restrain people with mental health conditions, were melted and forged in 1953 into what is known as the Mental Health Bell. This bell represents the progress we have made and stands as an empowering icon of mental health in America. While the 20th century saw overall improvements to the treatment of people suffering from mental illness, bizarre and dangerous treatments were practiced regularly. Surgical procedures such as lobotomies, which involve removing brain tissue to treat schizophrenia and other disorders, were used as late as the early 1950s until someone realized it was completely insane. In 1949, Australian psychiatrist J.F.J. Cade introduced lithium for the treatment of bipolar disorder, which became widely used beginning in the 1960s. This was the first widely used psychotropic drug and sparked a revolution in psychiatric medicine. Drug treatments such as lithium and thorazine were the first treatments to address the physiological source of mental illness and would allow severely mentally ill people the chance at an independent life. With psychotropic drugs giving people with severe mental illnesses the ability to live a somewhat normal life, the need for permanent inpatient care plummeted. Access and affordability were made possible by the enactment of government-funded Medicare and Medicaid, which allowed disabled and elderly citizens the ability to attain the medical attention they needed. In 2008, the National Institute of Mental Health released data on Americans suffering from serious mental illness, which they defined as mental, behavioral, or emotional disorder which cause serious functional impairment. This data shows that 1 in 20 Americans require substantial medical treatment in order to function at a normal level. So what happens to those who don't receive treatment? In order to get the necessary treatment, people with mental health problems need to have affordable access to psychiatrists as well as the medications they prescribe. The problem is, most Americans need medical insurance in order to afford these basic mental health services, but with many Americans lacking medical insurance, these people are left to fend for themselves. This is the result of our broken healthcare system. When people depend on consistent medical care in order to function independently in this society and they can't afford it, they end up on the streets. This is not simply a moral problem. Homelessness is an economic and safety issue that needs to be addressed for the good of the entire community. According to the Substance Abuse and Mental Health Service Administration, 1/4 of the homeless population in the U.S. is suffering from a severe mental illness, compared to 5% of the general population. A large portion of the homeless problem in this country can be addressed by fixing a broken healthcare system that the rest of the developed world seems to have figured out. So what's holding us back? Healthcare is big business, and health insurance companies have lobbied heavily in Washington to keep the money flowing their way. Under President Clinton, and recently under Obama, healthcare reform, including a government healthcare option separate from for-profit insurance companies, has been attempted but systematically pulverized by a healthcare industry with powerful political allies. Another symptom of this broken system is the prevalence of people with mental health issues in our prison system. In 2006, the Bureau of Justice Statistics released a report stating that the amount of mentally ill inmates has quadrupled since 1998. Instead of treating mentally ill people in hospitals, they're getting stuck in our overflowing prison system. The National Sheriff's Association and the Treatment Advocacy Center found that, on average, a mentally ill person is 3 times more likely to end up incarcerated than hospitalized. This was a national average, and there were variations among the states. The worst states were Nevada and Arizona, where a severely mentally ill person is 10 times more likely to end up in prison than in a hospital. The overcrowding in prisons has forced many states, notably California, to outright release prisoners because they simply can't handle the growing populations. This can only be a temporary fix, since without necessary support, released offenders, especially those suffering from mental illnesses, are likely to end up right back in prison. The most logical solution would be to prevent the endless cycle by providing support for released inmates. In 2005, Greater Trenton Behavioral Healthcare in Mercer County, New Jersey, provided secure housing and medications, as well as connecting clients to treatment and public benefits. The reincarceration rates during this project were 20%, compared to the national average of 81%. We know how to fix this epidemic. The issue is funding and implementation. So what can you do? With such an overwhelming systemic issue, it's hard to imagine being able to put a dent in it. The easiest way is simply educating yourself on the facts and spreading the word. Spreading awareness can be contagious and is a necessary first step. Every year, there are local, state, and federal bills which will affect funding for programs and services that affect mental health care in America. By being active in our political system at every level, we can all make our own contributions towards fixing this social injustice.